Of rashes. My symptoms were all over the map, and really no one knew what to do with me, because in the Western system, you need to fit into a bucket. If you're not a GI doctor's problem, maybe you need to be a surgeon's problem. Oh, surgery is not going to help you. Let's go see who can help you in infectious disease, for instance. And that's sort of how I was passed around as a chronic illness patient at first, before I finally got my answer. The answer to what was dragging me down, after all of my labs were normal, except for one marker, which was my white blood cell count. And if you don't know, your white blood cell count is a marker for infection. It's high when we have infections, and it's very low when your immune system is shot. And so my immune system was shot, and my white blood cell count was extremely low. But that was the only thing that the doctors could find. Until I worked outside of the system, until I left the bubble of Western medicine and started to explore alternatives. Now, I had been an acupuncturist and studied Chinese medicine and understood root cause. But I think sometimes when you're caught up, when you are the patient and you are so desperate to figure out what's going on, I felt so crazy that I couldn't take care of my family, right? At the time, let's see, when I was diagnosed, I was close to 40. And I should have been young and vibrant, and I was barely able to get out of bed, and subsequently depressed, right? How could you not be when you're chronically ill? I think it's always a mental game to stay mentally well when you're being beaten down by a system that keeps telling you they don't have answers for you, even though you feel like you're dying. So I wound up having Lyme disease, so that was my first diagnosis, was Lyme disease. But upon further investigation, it was Lyme disease with Bartonella, Babesia, and Rocky Mountain spotted fever. Those are 3 separate bacterial infections that you get from a single tick bite, most likely a single tick bite. In fact, I had never seen a tick bite. I wasn't much of an outdoor girl back then, and I'd come from New York City, Boston before that, and then had moved to the suburbs of New Jersey, where I guess I picked up a tick that gave me those 4 infections, and spent a lot of time trying to kill Lyme disease. Saw several doctors, had an IV of antibiotics, wound up with a massive blood clot in my chest, whole other story. But then I eventually gave up on Western medicine and said, these antibiotics are making me sicker. In fact, what they did was ruin my gut. It gave me a lot of focus on gut health. I wrote a book called The Constipation Code about gut health. But it really didn't serve me to take all those drugs. Trying to kill the Lyme disease was not the answer to making my body better and stronger. In fact, I was in no position, being so weak and so undernourished and just so beaten down mentally, that I wasn't in a position to fight Lyme disease. Instead, I needed to have the grace and the knowledge to go inside and take care of myself, right? I talk to my patients and clients all the time about nurturing yourself like you were that 3-year-old that needs to be put to bed when you're not feeling well. If you had a 3-year-old and she was staying up late at night, you recognize as a parent that that's not a healthy behavior. We need to treat ourselves the same when we're not feeling well. And that's exactly what I had to do for myself. Not only did I have the Lyme disease, Babesia, Bartonella, and Rocky Mountain spotted fever, but upon further investigation, it was found that I actually had some exposure to toxic mold, and I was riddled with parasites. Never in a million years had considered either of them. I consider myself clean. My house doesn't smell. I don't have mildew. I don't have mold in my showers or my toilets. Yet there was a mold problem behind a wall in my house that I didn't know of until my house burned down in 2016. But again, a story for another time. And so once I did the work of detoxing my body, heavy metals, candida, mold, environmental toxins, parasites, I couldn't even touch the Lyme disease. Remember that parasites are inside of you, scooping up and eating all the bits of yuck. And so if you have an infection, those parasites are going to take up that infection. And until those parasites are gone, that infection will continue to brew in you. So for me, really trying to fight Lyme disease, which is a microscopic organism, right, was not the first step in my treatment. And that's what I do with clients now. When people come to me undiagnosed, I know everybody is so desperate for a diagnosis, and there is great testing. We do amazing Lyme disease testing for all co-infections and reactivated viruses, because a lot of times when you have Lyme and you've killed your immune system, right? My immune system was really, really shot. You're leaving your doors open for other infections. So we look for all of them. Once we know what we've got, we know how to treat, we know how to prioritize. We always look for mold. We always assume parasites. We all have them. And if you've been really sick and debilitated, that's when they do their best work, right? So getting rid of the parasites, of the heavy metals, of the mold comes first. It is the first step in healing. That combined with the reprogramming mentally, right? Because a lot of us have some PTSD, a lot of trauma and anxiety about health and healing when we've been told there are no answers, when we've been told there is no hope. So those two things are where we start. Some brain retraining and some detox. So if that sounds like you, if you have been undiagnosed and you don't know where to turn and you'd like to get the ball rolling on emptying your body of all the toxins that are keeping you down so we can really figure out, once we've got a clear picture, like think of it as looking into a muddy lake, and once that water clears, you can actually see the fish and the rocks and what maybe doesn't belong there. We do a lot of testing sometimes after we do the detox, because we know that if you're not feeling well, that your results are going to light up. So let's do the work, get the toxins out, and then test for what work we still have to do. That's the work I do. I also work in gut health. It's all connected, right? Don't let anyone tell you that you are just in buckets. When we go to Western medicine and they make it a GI problem, they make it a neurological problem, right? They separate us. We are one unit that needs to be cared for at the same time. So that's the work I do. My name is Melissa Hall-Klepacki. My name is my website. You can find more information here on my channel. Thanks for watching.